joining us now as we try and get an understanding of these numbers. They are astounding numbers at this stage. Dr. Rajesh Parekh, Director of Medical Research at Jaslok Hospital, Mumbai, to talk about the situation in Mumbai. I'm also joined by Dr. Ashok Seth, Chairman of the Fortis Escorts Heart Institute and the Head of Cardiology of the Council of the Fortis Group of Hospitals. Dr. Seth, let me come to you first. 5.5 lakh potential patients by the 31st of July. If we aren't in community transmission, then what exactly are we in?
So Vishnu, I think it's a matter of semantics, and I think we should deviate away from the fact that whether it is community transmission or not. The numbers themselves say what they're supposed to say. So I'm going to be totally apolitical about this. I'm going to talk as a clinical leader, and I must say right at the outset that let's not put this into politics. I think the Delhi government has been very sincere in its efforts, and I'm very happy that the Chief Minister has turned out to have negative tests for COVID, and I wish him the well. But this is something which was to be expected. While the numbers may sound horrific when you label it as 5.5, but if you go see what's been happening, if you see that we've unlocked at the time when we're going to the peak, if you look at both Mumbai and Delhi, which are capitals and metro cities where difficult socio-economic circumstances are there, the large areas of congestion. Sometimes it's even a joke to talk about, a harsh joke and a harsh reality to talk to people about physical distancing when 6 people live in a small house. And many of those who now are unlocking are actually not wearing even masks and following those protocols. So the real issue is not what are these numbers, but how do we tackle them? It's a reality, it's in front of us. And most of the discussion should go around, how do we get together to tackle the problem? And if you give me time, we can discuss that right now, or if you want to discuss that later. But that's the real issue. I think everybody's been sincere. Now we should actually get over the political blame game. We should not find scapegoats. The only scapegoat we should find is the coronavirus.
Okay, Dr. Seth, just one moment. I wanted to go across to Dr. Parekh as well. Dr. Parekh, why don't you answer that question or get in your views? Assuming it is community transmission, let's not use the words because, you know, the center has not said it, whatever. Given the caseload, what should our strategy be going forward, particularly at a time when we have decided in this country that we need to unlock? Because if we don't, then the future of lakhs of people, millions of people in our country becomes uncertain for all sorts of other reasons. So given this reality, how do we reformulate? What would that be?
Well, you're absolutely right, Vishnu. We need to be focused on the solution. But at the same time, we cannot disconnect completely various elements into this spread. So there is the mathematical perspective, there is the medical perspective, there is the social angle, there is the economic angle, and there is the political angle. And at various times during the proliferation of this pandemic, each angle has had a little more importance over the others. So at the end of January, when we first started warning about the pandemic that was to come, at that time it was largely in Wuhan, and when we started talking about it in our book on the coronavirus, a lot of people thought that we were being alarmist. At that point in time, it was the mathematical model. The mathematical model, and mathematics is the most precise of all the perspectives we're looking at, pretty much predicted what we are into today. And it took a while for us to come to terms with the mathematics of it. And then for a large segment of time, until relatively recently, I would say maybe about 5 weeks ago, we were looking at the medical angle. What is it that we need to do in terms of containment, in terms of testing, in terms of tracing, in terms of isolating? And up to that point, perhaps one largely needed to listen to the medical experts. But then it transgressed beyond mathematics and medicine. It has now entered into the social angle. You know, it was absurd for us to expect the kind of physical isolation that the illness dictated when you have so many millions of our people, the large numbers of people in our country, you know, living in small areas and in poverty. So the social angle was certainly very important. We could not divorce the medical and the mathematical from the social. And then, of course, there's the economic angle. At what point does hunger take priority over illness? I mean, hunger kills as many people, if not more. In fact, it certainly kills far more people than the illness. And then, of course, there's always the political angle, which we like not to talk about, but that's the elephant in the room that we should not ignore. because the intersection of all these perspectives is where our true solution lies. So now there are things that some of us as medical people with a little bit of understanding of mathematics would not fully comprehend until the economics comes into the picture, until the sociologists come into the picture, and until we understand what is happening in the political situation. Because the political situation at the end of the day dictates policy, and policy is what matters. So we need to take all these perspectives into account. The doctors need to step back a little and understand that it's not just the medical aspects that are important. The economics is important. The migrants and what's happening to them is very important.
Right.
And in terms of all this, in a nutshell, we are now way beyond containment.
Right.
No, whether we call it community spread or not is a technicality, but we are now into mitigation and into treatment. The worst is still to come. The numbers are escalating and they will continue to for some time. Undoubtedly, it will taper off. Undoubtedly, there are good times ahead, but they are not going to happen on their own.
All right.
We all
Well,
need to work
Dr.
together.
Parikh, I think what you say over here, it's a sad reality, but it's something which we were hoping wouldn't happen if that curve was flattened. That curve has not been flattened in India. Yes, when we had a lockdown, we didn't see these kinds of numbers, but that lockdown is gone. It's going to take a few months. Hopefully, by then this would get somewhat better. But unless there's medical treatment which comes along, and that's going to take a while. We are in it for the long haul, and it appears that we are headed the way that many other countries, unfortunately, have experienced. I'd like to thank both of you very much for joining us.